The time is just gone 18 minutes past 8 a.m. this morning on News and Views. And we kick off this morning looking at the South African Medical Association, who have called on the management at the Robert Sobukwe Hospital in Kimberley to explain how two doctors were allegedly stabbed by a male patient at the weekend. Now, according to the association, they say that the stabbing is yet another example of public hospitals in the country failing to protect or adequately protect staff. And we joined this morning by Acting Provincial Secretary at Denosa, Bongani Mazibuko. Bongani, good morning to you and welcome to the show.
Good morning and thank you for having me.
Yes. Now, Bongani, this incident that has taken place at the Robert Sobukwe Hospital, what do we know about the incident?
Well, so far the details are not yet clear, but we know that there were two doctors who were assaulted, actually allegedly stabbed in the hospital where they are working. And it's quite unfortunate and sad that you'd have incidents of this matter, of this magnitude, still occurring in this day and age.
Well, certainly, and as you say, in this day and age, in the day and age of COVID, where we find healthcare workers and medical personnel are under extreme pressure and to be concerned about their safety, I suppose that adds a lot more pressure, a lot more stress on the part of healthcare workers.
Oh, definitely. Not only do you need to worry about taking care of the patients that are coming in now, you also need to worry about your own safety. And if you are worried about your own safety, then it makes it difficult to be able to do your job. So in a way, this is actually affecting the staff and the people in a negative way, and they are struggling in order to be able to do their jobs. And
Yes.
unfortunately, I think, yeah, okay.
No, carry on,
Yes,
Bongani.
I think it's important that we state this on record to say incidents of this nature are not new. These are things that we've seen happening, and as Denosa and Nosama as well, we have been advocating for the Department of Health and the employers in general to do a lot more to ensure the safety of the employees when they come to work. And it's unfortunate that not enough is being done, and we still have people getting injured or being attacked at work.
Yes, and this is now the sentiment that has come through, a strong sentiment on the part of the South African Medical Association, who have made it clear, saying that this is yet another example where healthcare workers are not adequately protected, Bongani.
True. Yeah,
Yes.
it's definitely it's disheartening, and I can even give even I think on Tuesday I had the same engagement or interview with one of the other stations whereby a doctor was also attacked in Lilian Ngoyi here in Gauteng, and it's surprising because for us here in Gauteng, to make matters worse, we have actually even proposed a project to the Department of Health. We've called it a safety campaign, where we wanted to highlight the issue of safety for healthcare workers. And that project has been in the pipeline and it has been presented to the department. It's been 2 to 3 years now that it's lying in the Department of Health offices, and it's been engaged upon, but no progress is made. Every time we want feedback to say when can we implement this, there's no answer. They just keep saying that it will be postponed to the next meeting, 3 years of no movement. That shows how much interested they are in making sure that the staff is safe.
Yes, obviously this is not on and it's not acceptable. I mean, as you're saying, 3 years down the line and nothing is being done. And just looking at the project, I mean, what are some of the key issues that you have addressed as far as this project is concerned?
Part of the key issues that we've highlighted and that will be addressed by the project would be to make sure that communities are aware that it is also their responsibility to ensure the safety of the people that are coming there to offer services. Because what we've seen is that even with the Free Zuma looting, whatever that took place a few weeks ago, we saw that healthcare workers were also targeted during that time. So it's important that we make sure that the communities embrace healthcare workers as one of their own, and that they make sure that the healthcare workers are safe. And secondly, we're also calling on the government to make sure that there's insourcing of security services and improvement of the people who are providing security services in the Department of Health. Currently, you say you've got security, but only one person will be carrying a baton. And that is not adequate when you've got people who are coming in the evening being tipsy and So we need to also have a lot more institutions that would be offering more services to the communities, because part of the thing is frustration. And lastly, one of the most important as well that needs to be highlighted is what kind of services do we or do the institutions offer at each level of care? Because people right now, people will be coming into a clinic expecting to get services that would only be offered at a tertiary institution, not a district institution. Or someone would skip all the levels of care and want to go to a hospital like Steve Biko, where they've overpassed the clinics and CHCs. So those are some of the things that need to be done so that we can be able to ensure the safety of the employees out there.
Yes, and also I think Bongani, it's interesting you say is the time of the day or the time of the night when these incidents are likely to happen, and
Mm,
particularly looking at casualty wards, because this is where a lot of activity is taking place. This is where people come at all times of the day and night, and this
mhm,
is absolutely important. This is critical at that time because this is where doctors are under severe pressure, but also at the same time looking at doctors that are serving these public hospitals coming and going out of the hospital at some odd hours as well after doing what
mm.
they have. So, this is important that this matter be addressed.
Yeah, definitely. And you cannot be having a hospital like Lilian Ngoyi or any of these other hospitals whereby the doctors and nurses are coming in and going out, but there's no Apollo lights even in the parking area. The parking area is dark. When you go out there, there's no that is not a concern for safety. And then you've got a fence that is torn and or it's got an opening for thugs to come in and go as they please. If you are aware of these things during the day, but you're not even doing anything to make sure that those things are taken care of, those are simple things that can be attended to if without having to wait for a budget. You just have to make sure that you attend to them. You provide a floodlight. You provide the mending of the fence to make sure that the people are safe. It's simple things that need to be done. We cannot just want to go to the big things, but leaving the smaller things that are actually compromising the safety of the employees as well.
Yes, and also, Bongani, the fact that you have had no response on the part of the health authorities tells us that there appears to be a lack of interest. What more can be done?
Well, probably it's going to come to a point where maybe we might need to take to the streets as healthcare workers. Um, I don't see any other way, because we've been talking and talking and talking, and it shows clearly that talking is not yielding the necessary results. So maybe we need to consider our options as a healthcare worker representatives to say that how do we get this mountain to move, and probably with the help and support of the communities behind us also rallying to ensure that to raise this awareness, to say that healthcare workers are at risk. A few years ago, I think about 2 years ago, the International Red Cross did a study that found that a healthcare worker in South Africa is much more to get attacked than a healthcare worker who's working in a country like Afghanistan or Sudan. I mean, a war-torn country. What does that say to you? We can't be living like that. You know, we are supposedly free, and yet we are not able to provide a simple safe environment for people who are providing health care for us as a country. That cannot be acceptable.
Well, it certainly is not acceptable. And Bongani, thank you very much for that, for the update, and for coming on and talking to us this morning here on News and Views and Salam Media. All the best to you. We wish you well. We definitely will be watching this space and the developments as a result of what has happened in Kimberley.
Thanks for your time.
Bongani Mazibuko joining us this morning, and he is the acting provincial secretary at Denosa. And as Bongani says, this is totally unacceptable. 3 years ago, proposals were made with regard to projects and ensuring the safety of healthcare workers and doctors, and nothing is being done 3 years later. The time is just gone 8:29. We come back, we'll be talking about the unfinished war of Zakaria Zubaidi.